An arm lift is a surgery that gets rid of excess skin and fat of the arms. There are patients that have had weight loss and they have like skin hanging from their arms, or they just have what they call the bat wings, and they want to get rid of those. And the arm lift is a great surgery for that. The arm lift involves usually liposuction, and then we make an incision along the arm and we remove the excess skin. We try to minimize the scar by not taking too much skin, but just taking enough. If you take too much skin, it's too tight, then the scar can widen, it can hypertrophy, and it can look not as attractive. Post-surgery, we're very careful with the incision. We place ACE wraps on the incision, and we try not to force a garment on the incision because the skin of the arm is very, very delicate and it's thin. So we have to be careful wrapping the arms to stabilize the incision. And then after a week, we'll transition from an ACE bandage to an arm garment, because then we're able to pull the garment on and not worry about having any trauma to the incision. I typically ask patients to be very, very careful with the movement of their arms for a couple of weeks. Our practice is a great place to have a brachioplasty of arm lift surgeries, because I have had a lot of experience with arm lift surgeries. We also have a lot of before and after photos that you can see of our patients of how the incision looks, where the incision is going to be placed. We try to give a great result because that incision is always there. You'll always see the incision, but we want to minimize the incision. And over time it does get lighter, but that incision is always there. So we try to make sure that it's going to look the best that it can, and that you can wear any type of clothing that you want to, even the sleeveless shirts.